Well, certainly nobody wants to hear that they've got cancer, but if you do get that diagnosis, there is one cancer treatment center here in the Valley that is giving cancer patients some new hope. It's called Phoenix Cyberknife Center, and joining us now is Dr. Lauren Stegman, telling us a little bit more about why his center has a different approach than perhaps some of the others in town. It's good to see you. Good morning.
Hi, Stephanie. It's great to be here.
Let's talk a little bit about the treatment options for prostate cancer, in particular at Phoenix Cyberknife.
Sure. Well, we're happy to announce that Medicare has now opened up some new treatment options for prostate cancer patients in Arizona. And that specifically is a new kind of radiation called Cyberknife that's been around for about 5 years now. It had been available around the country for Medicare patients, except in the Arizona region. And now, as of December, Medicare in Arizona will be covering it.
We're looking at some images here, and explain how this works with the Cyberknife treatment for prostate cancer that is different, let's say, than different types of external radiation.
So the main difference with Cyberknife is that the treatment can be given in 5 days instead of 8 or 9 weeks. And the reason why that is because the Cyberknife can very precisely target the prostate and keep track of it in case it moves at all during the therapy, so that the radiation beams are always focused very precisely on the prostate itself. The advantage of that is we can give a bigger dose of radiation each day, so people can get finished much, much quicker in 5 days rather than 8 or 9 weeks. The side effects all are essentially the same, and from all of the data that we have available so far of almost 1,000 patients treated for over 5 years, that it seems to work just as well.
Wow, okay, so if you can compress that time, that's certainly a huge benefit. Now, I want to talk about staging, because so many times when you get that diagnosis, and I had a couple friends who have gone through this in the last year, it's that, what stage is what they're consumed with. So where can you use Cyberknife along the staging spectrum? And then additionally, can every type of prostate cancer respond as successfully as you mentioned to Cyberknife?
Sure. So there are many different types of prostate cancer, and we determine what's going to be the best treatment for someone based on the stage, which means where the cancer is in the body, if it's only in the prostate, if it's in the prostate in the lymph nodes, or if it's spread somewhere else. But other important things are what's called the grade. That's how the cancer looks under the microscope, how aggressive it is. And Cyberknife can actually be used almost across the spectrum. It's really best, though, that 5-day treatment for patients who have what we call low or intermediate risk cancers. So those are cancers that are confined to the prostate, that are of sort of the garden variety type or slightly more aggressive. If the cancer is one of the more aggressive types, sometimes we have to add other types of therapy as well, or other types of radiation might be better. And a patient who has disease that's spread somewhere else in the body, sometimes we can use Cyberknife to treat a spot in the bone or in a lymph node that's causing them pain or some sort of symptom to improve their quality of life. But in those cases, it's not a curative treatment. It's meant to help improve people's quality of life.
Well, lastly, I want to know how the side effects fare with this sort of procedure.
Sure. So when talking about patients who are getting curative treatment for cancer that's confined to the prostate, the side effects are remarkably well tolerated. During the week of treatment, people really don't experience much at all. It's usually in the few days after that they might have a little bit of irritation of the urination, going to the bathroom a little more often, maybe a little burning, maybe a little more frequent, and also maybe a little bit of irritation of the bowel movements, but it's usually quite mild.
Okay.
So,
well, I want you to stick around, because I know that our viewers probably watching have some additional questions, and so we're going to provide them that opportunity. But in the meantime, Phoenix Cyberknife and Radiation Oncology Center is joining us the first Tuesday of every month answering your questions, and you can begin emailing them at info@pcroc.com. You can find them at 4611 Shea Boulevard. That's, of course, in Phoenix. The phone number to call them directly is 602-441-3845, and a wealth of information over at phoenixcyberknifecenter.com.